Alright, my name is Joshua. I'm a second year student nurse from Kumasan College. So the skill I'll be doing today is administering Cefazolin. Alright, so the patient I'm caring for today is diagnosed with septicemia, which is a bacterial blood infection. So I can see here on the lab results that their white blood cell count is elevated as well as their neutrophils count. So that indicates infection, and they also have like a temperature of like 39. So in this case, they're gonna need an antibiotic. So I'm just gonna check the doctor's orders over here, see what kind of antibiotic they're getting. So the doctor has ordered Cefazolin, 1 gram through an IV every 8 hours. So I'm just gonna compare that to the MAR. Alright, so Cefazolin 1 gram IV every 8 hours, and I'm gonna give this 600. Okay. So after I've checked my medication, I'm just gonna go over to the IV monograph. So Cefazolin is a cephalosporin, and I'm just gonna make sure that there's no monitoring required. And this medication is to be given 3 minutes. So I'm just gonna do my calculations over here. 10 milliliters over 3 minutes. Alright, so the rate I'll be giving this medication is at 0.83 milliliters over 15 seconds. I'm also going to be aware of the adverse effects, which anaphylaxis. I'm also going to be aware that the patient has nausea, which could be mistaken for an adverse effect of this medication. And I'm just gonna make sure. Yeah. Oh, I'm also gonna be aware of like the effects of speed shock. So if the patient's feeling loss of consciousness, irregular heart rate, if they have a headache and they have a tight chest. All right. So and then I'm also going to be checking their HIT care plan, see if there's if I need dressing change. Nope. So this is going to be on their right arm, insertion site, brachial, and the external segment is 5 centimeters, so that's good. All right, so just gonna do my 3 checks. So this is for Patrice. And then I'm gonna do my 10 rights. So this is for, right patient, right medication, right dose, right route, right reason, right time, right documentation, right assessment, right to refuse, and okay, we'll just leave it at that, but so I'm also going to be checking for the expiry date, so it's not expired, so that's good. Alright, so it's ready to gather all my equipment. So before I do that, I'm actually going to be patient, so this for crease. So Cefazolin. Alright. So now we're ready to enter the patient's room. So I'm just going to gather all my equipment over here. So before entering the patient's room, I'm just going to perform my PCRA, making sure there's no any precautions that requires me to wear personal protective equipment. However, in this scenario, I'm going to need to perform hand hygiene for 30 seconds to prevent any infection. And I'm also going to be wearing some gloves. Alright, so I'll enter the patient's room. So I'll introduce myself to the patient. Good morning, my name is Joshua. I'm a second-year student nurse from Camosun College. And so for today, I'm just going to give you some antibiotics just to treat your septicemia, which is a bacterial infection. Yeah, if that's all right with you.
Okay.
All right, so I'm just going to provide some privacy over here. Just going to draw the curtains. All right, Pat, so how are you feeling today?
Not bad.
Yeah, are you feeling any nauseous?
Not really.
All right, that's good. All right, Pat, I'm just gonna make sure I have the correct patient over here. So do you mind telling me your name, first name, last name, and date of birth?
Pat Reese, July 4, 1945.
All right, and do you have any allergies?
No.
That's good. All right, Pat, so before I give you the medication, I'm just going to be assessing the site. So I'm just going to be looking at the dressing, if it's dry and intact. I'm also going to be assessing the PICC line. So make sure there's no punctures or anything like that. I'm just going to be assessing around the skin, making sure there's no redness, bruising, exudates present. All right. So the first thing I'm going to do is I'm just going to flush your PICC line. Just make sure that the lumen is patent. So let's go this way. And if you have any questions, comments, or concerns, just let me know. Alright, so I'm just going to prime my normal saline syringe. Alright, Pat, so this shouldn't hurt at all, but if you feel any discomfort, again, just let me know. There we go. Alright, so I'm just gonna flush for like 2 milliliters. And I'm just gonna check for blood return. Go. Flushing that all the way. Make sure I don't bottom out. All right. All right, Pat. So before I administer your medication, I'm just gonna make sure I have the correct patient over here again. So can you tell me your name and date of birth?
Pat Reese, July 4, 1945.
All right, cool. So again, you shouldn't like feel any discomfort when I give you this medication. And I'm just gonna set up my. Oh, so before I give my medication, I already like measured my external segment. Make sure it's like 5 centimeters. So that's good. Okay, so. And do you have any questions, comments, or concern before I get started?
No.
So this might be like a long, time to administer. So do you need to go to the washroom or anything?
No.
All right. So. All right, Pat. So I'm just gonna give your PIC line another flush, just to make sure there's no like any like medication left in the lumen. Okay. And this. And I'll be flushing at the same rate as the medication for the first like 3 mils. just gonna proceed to the push pause method. So, making sure I don't bottom out the syringe. There we go. Just gonna keep this up here. Yeah, so how are you feeling, Pat?
Not bad.
Not bad. All right, so that was everything. So I'm gonna check back up on you after 30 minutes to see how well you're doing. In the meantime, if you have any questions or concerns, just ring the call bell right here. Right. And I'm gonna lower the bed down. Yeah, so after I've exited the patient's room, I'm going to document on their lines and devices section. So their pick assessment, as well as I'm going to sign off my MAR. Yeah, that's everything.